Welcome to another episode of Rehab Now with consultant physiatrist Dr. Paula Dawson, our rehabilitation medical doctor. I'm your host, Alicia Taylor. Hello, Dr. Dawson.
Hello, Alicia Taylor.
Yeah. People call me all kind of...
Sorry.
It's fine. Remember to check out our social media pages. Instagram is Rehab Institute Caribbean, Dr. Paula Dawson, Alicia Taylor Music. On Facebook, it's Rehabilitation Institute of the Caribbean, and our website, rehabcaribbean.com.
Yes, ma'am.
Now, in Jamaica, we like to say, so nice, we have to do it twice.
Hey.
So this is part 2 to the running injuries.
Yes.
We talked about IT band syndrome and
Runner's knee.
runner's knee. There was a
Runner's knee.
runner's knee, because I keep thinking about plantar fasciitis.
Oh, patellofemoral syndrome.
Right.
Yes, yes.
But it's not plantar fasciitis, obviously.
Well, we're going to talk about plantar fasciitis today. Insightful.
Thanks.
Insightful.
I'm not doing bad on this medical show at
She's
all.
doing excellently, ladies and
Thank you very much. So we're going to dive into a little bit more of the running injuries, because apparently it's a whole host of them.
There are a lot of running injuries that we can get as runners. Again, people are becoming healthier. People are wanting to get fit. They want to lose weight. People want to live longer, and we're living longer. And not only are we doing it because we want to live longer, we want to do it to be healthier, to be more efficient. Because the fitter you are, the better your mind is. Fitness leads to more efficient ability to concentrate. You understand?
And you only get these injuries if you're a runner.
No. These are common injuries that can be seen in running.
Okay.
So we're going to talk about. So last week we spoke about the injury around the knee called patellofemoral syndrome, which is the maltracking of the kneecap. We also spoke about running injuries that are associated with the IT band. One around the knee, also called runner's knee, and one by the hip called IT band syndrome or snapping hip, which you can get that. So today we're going to talk about other injuries that you can get. You can get shin splints. We're going to talk about shin splints. You always hear the high school students having shin splints.
That's funny.
Yeah, shin. You ever hear about shin splints?
Oh, yes, it's just the name.
Right. Shin splints, I don't know where that comes from, right? We're going to also talk about injuries around the ankle, like the Achilles tendon. You can get Achilles tendonitis.
Yeah.
Very good. That was the old name. They now call it Achilles tendinopathy, because there are different types of inflammation that can be associated with it. We're also going to talk about plantar fasciitis, which you can get in the bottom of your foot. But we're also going to have to mention stress fracture, which is a hairline or a crack in the bone that you can get with overuse, with excess running, either in the big bone in the leg, which is the tibia, or the little bones, because you have two bones running from your knee to your ankle. One is called the tibia, which is the bigger one, and the small one, the fibula. You can get a crack or a little hairline fracture in either of them or both.
Ooh.
You can pull a muscle when you're running, or you can have ankle strain. Right? You can also get stress fracture in your foot, in the foot, in some bones called the metatarsal bones. Or
Stress fracture.
stress fracture. So fracture of the bone from stressing it overuse kind of a stress. You can have stress fracture in any of the two bones I mentioned, the leg bones, or your heel, the big calcaneus. You can get a calcaneus stress fracture. Yes, man. You can get a fracture in the metatarsal bones. And there are other things you can get. Other running injuries include blisters. You can get blister in your foot, the back of your foot. You can get corn calluses. You ever people say I have corn?
Trust me.
So those calluses can be quite painful. You can get toenail injury, ingrown toenail. I have lost my toenail after running a marathon.
Toenail.
Well, I never run a marathon. Ingrown toenail. So I know people who have done carnival, street march, and after that they lose their toenail. I know when I used to work in Chicago at marathon, people after they run the marathon, which is 26 miles, a whole heap of miles,
26 miles.
they lose their toenail. So these are some of the injuries that we're going to talk about now today.
Excellent.
So which one you want to start with?
Let's start with shin splints.
Oh, I know you were going to do that one.
Or shin splits. Oh, wait.
Splint. It's a splint.
Shin splint.
Right. So shin splint. Shin splint is pain over your shin.
I don't know what your shin is.
You don't know your shin?
That's terrible.
Ladies
Is that
and-
that hard knocking on the inside of your ankle?
Oh my no, your shin is your, people call it shank. I've heard that word before.
Yeah,
It's
I'm a
a
shank. I
shank,
say
the
shank.
shank.
Yes.
It's not the shank, the shank.
I'm a shank. Yes.
So it's
yes.
the bone between the knee and the ankle on the inside, that little part where you can actually touch the bone, the tough part going down.
between the knee.
And the ankle. On the inside, that part where you have, reach down, ladies and gentlemen, not if you're driving.
Please.
Yes. So between the knee, reach down towards your ankle. You feel that tough part?
That's what I was asking, if that is your shank. Yes.
We don't
that's
know
up
any of
there.
shank.
I know. Yeah, sorry,
Shin.
your shin.
Your shin. So the tibia is your shin, not your shank.
I stepping on my shank. I me
I
always
know,
say.
man, that play football and stepping on my shank.
Yeah.
Stepping on my shank.
We're making a song.
We're
oh
making
my
a
God.
So shin splint is another word for shin splint. Some people call it the medical term. You can get medial tibial stress syndrome. That's on the inside.
Oh, so shin splint was not the medical term.
It is a medical term, but the more medical term.
Okay, because you have medical and then you have medical. Got it.
Yeah, man. And then you have another super medical.
You're joking.
No,
Wow.
I actually am joking.
What is... Jack, come on.
Okay. All right. So let's come back now. So the shin splint, also called the thing with shin splint, is you have medial tibial stress syndrome, and you can have posterior tibial stress syndrome.
Right.
But the more common one is medial tibial stress syndrome. And so people will tell you that they have pain over that bony part between the knee and the ankle on the inside of the leg. It can be tender. You can feel lumpy, bumpy. You can feel bumps in it. Yeah, it actually can be. You can actually see, with some of my athletes, when you look at them, you see the bump, which is inflammatory reaction to the constant inflammation that they have in that area. They usually complain of pain in the shin, especially when you first start running. When you run more, it goes away initially. But if you continue to run for too long, it comes back. And that's a difference between the shin pain from shin splints and the shin pain from a stress fracture. It's important because a stress fracture, shin pain, as you run more, the pain gets severe till you start hopping. Right? So shin splints, most commonly seen in runners, it's an overuse injury, usually, from an overuse injury. And it can be as a result of, one, you change your running distance, you start run too
Further,
far, too quickly, rather than getting gradually into it, right? Or two, you change the surface, so you're now running on an incline, going downhill or uphill or a slant slope in some way.
Right, okay.
Right? It could be that the surface is uneven. You're still running on a level surface, but it's uneven. So you've changed the surface, which can cause that too. Commonly seen, it can be caused from tight calves. So when your calf muscle, which is the gastrocnemius muscle is tight, that can tug on the bone as well. And it can be caused from pronated foot. Biomechanics at the foot can cause shin splints. So a whole heap of things can cause shin splints.
It's crazy.
Right. So patients, they come in and they have a lot of pain. You touch it, they almost jump off the bed.
You said something about inflammation.
Yes.
Can they get water in that area?
I like that question. So inflammation is edema in the tissue. The reason you get fluid in the knee from the last episode,
fluid.
No, you're correct. You're absolutely correct. So inflammation can be in the tissue. Because of it being in the tissue, you don't necessarily get like a pocket of pure fluid, whereas in a joint, it tends to have space for the fluid to out pocket.
Yeah.
But the inflammation that you get over your shin is swelling in the tissue. It's actually swelling in the tissue, so it gets bruised and then it gets swollen. So what happens, for example, if it's caused by a very tight Achilles tendon, which is your calf bone, your calf muscle. So every time you run, imagine that your calf muscle is so tight, it's tugging because it's inserted in the tibia, which is that bone at the back. So every time you're running, it's pulling on the bone. And there's the surface of the bone is called the periosteum, which is like a little membrane over the bone. And after a while, you can get what we call periosteum reaction, where that periosteum, every time you're pulling it, it gets thicker, and it gets inflamed. So when you look on an X-ray, we'll come to that, you'll see thickening of the periosteum, which is the the walls of the bone just looks a little thicker, right? So they come in and they say, oh, I have pain in my anterior, on the inside, anterior medial leg. Pain with running, initially running, but as I run more, it eases. But then if I continue to run, it gets worse. Another thing, before you go on, another thing that can cause it is if you run and don't give yourself time to recover. So remember I told you you could be because you increase the distance, but it can be because you increase the frequency. So instead of running 3 times per week, you're now running 5 times per week. So there's nothing wrong with running 5 times per week, but if you're running a long enough distance, you have to gradually get into it.
So you have the pain while you're running, but if you stop, the pain will ease.
Absolutely. Rest. I like that. Absolutely. So shin splint comes on with pain initially. It goes away. That's the thing with shin splints. Because once you warm up, in a sense, the muscle kind of relaxes, especially the gastroc muscle. But then as you continue to run more miles or more distance, the pain gets worse.
How long are you going to have to rest to really...
It depends on how much inflammation you have. That's a very good question. Some people, it might be overnight. Some people, it might be days. Some people, it might just be a rest for 2 hours and you have to run again. But that's a very, very good question. The resting, which is a part of the treatment, where you have to ensure that your calves are stretched out properly. That calf muscle is stretched out properly. So you feel that lumpy, bumpy, tender area over your shin or your shank. Your shank. And you get pain with running. Medial tibial stress syndrome. A lot of our high school athletes will have it.
Man.
Yes.
Thank you for that. With the shank. All right, so you have the
shin.
Sorry. So you have the shin splint.
Yes.
And then you have what other injury? But you know what? I don't think we have the time to go into that right now. Can we take a break?
I think we can take a break.
Yeah, let's take a break and then we'll come back and we'll talk about the other things.
Right. So what we're going to talk about when we come back?
Plantar fasciitis.
Plantar fasciitis, Achilles, stress fracture. I want to talk about stress fracture.
Yeah, we're going to stress. Oh, you broke your bone.
Crack, hairline.
Oh, you don't break it, just crack. We'll be right back. Stay with us.
Yes.
Welcome back to Rehab Now. If you're just joining us, this is our second episode or a part 2 episode to running injuries. And last week we spoke about IT band syndrome. And please help me with the P1 again. I just can't remember.
Patella
syndrome, that one. So today we just spoke about why am I keep on shank in my head? I'm stuck with the shank. Shin splint.
Right.
Injury. And now we move on to the other types.
Right. So when you're running, you can also get a stress fracture. And so one of our episodes...
Which is just a crack.
A crack or a hairline fracture in the bone.
So it no break.
Well, if you have a vase and it crack, no broke.
Oh, I don't know, because
it just not displaced. So it's hairline, meaning, I see your point.
I just thought it was just like a small thing. It's just like a little tiny crack. And
It is. Which means a lot of time you do not need surgery.
That's what I mean.
Oh, I apologize. You're correct. You're 100% correct. So a stress fracture is a hairline fracture which causes pain.
I'm sure it's excruciating.
Right. So we're going to do stress fractures in sports in our next episode. So listen, guys, next week we're going to do stress fracture. But I just want to mention it here now because earlier in the show we said that you have pain in your shin, which is your shank.
Yeah, your shank.
Which is just between the knee and the ankle. With stress fracture, if you have a stress fracture in the tibia, the pain gets worse as you run to the point where you start hop.
Yeah.
But you can also get stress fracture in the fibula, which is the smaller bone on the outside of your foot. Not shin splints, it's the outside now. So you can get that stress fracture. You can get some stress fracture in your feet, in your hip, in your back. We're going to come to that next week. Right? And there are certain people that are more prone to getting stress fracture. But I want to talk about something that we all see in running. So we all talk about running. It's not only jogging, running. Yeah, people who try sprint. Like me when I go sports day and pull my hamstring. So a pull muscle is a type of injury, running injury. So you can get a hamstring pull, your quadriceps muscle. You know where your hamstring is?
No. Is that the string at the back?
Yes,
The
miss.
foot?
Yes.
I do know it then.
So the hamstring muscle is the muscle that
That's painful.
bends your knee. Yes.
Oh my God.
So, and you can also get a pull muscle. A pull muscle, ladies and gentlemen, is a tear in the muscle. And we spoke about it in another episode. So go on Rehab Caribbean at our YouTube channel where we talk about muscle strain, right? Not a sprain. You sprain a ligament like your ankle and you strain a muscle. And a strain is a tear in the
bone.
And you fracture a bone. Good girl. Yeah, and you have a hairline. Stress fracture.
Crack.
And there's another type of fracture we're going to talk about next week called compression fracture.
Oh.
Yes, we're going to talk about that next week.
Excited.
You're excited, right? And so pull muscle is really where you stretch the muscle usually beyond its limit, and so it tears.
How do you stretch that particular muscle beyond its limit?
All right, I'm glad you asked. Now, muscle. All right, so if you're inflexible, your muscle is not flexible. Why do I say that? Because that is like
very
when you
clear.
ask.
It's very. I want you to know. I want you to know that's the simplest thing you have said all year. Okay.
Okay, let's try that again. It's like when they said, ask you to give a definition of a word. I use
I usually say a word.
Okay, so let me see how we can say that. So if your muscle, all right, so you see when you're stiff and you're tight up, right? When you go to run, because the muscle doesn't know how far it can go naturally, it's almost as if it kind of stuck together, literally, because you have these adhesions until you get back your flexibility. So if you are running and you don't stretch the muscle to prepare it to where you may want it to stretch to when you're exerting, it will stop to where it's used to. So if you're stiff and your muscle can only go like, I don't know, 2 inches beyond its usual resting position, when you go to run and you kind of stretch out your leg and you want to go 3 inches, it may tear, right? And you have different grades of tear, grade 1, 2, 3, 4. We'll look at our previous episode. You can see that. Now, you can also pull your calf muscle. So there's a calf muscle. We spoke about this called tennis leg.
Tennis, remember that.
Tennis leg is where you pull your muscle in your calf. But you can also pull your groin muscle. You can also pull your abdominal muscle running.
Which muscle you can put running?
And you can pull a back muscle running.
Well, yeah, I know about that.
Right. Not so much when you're running, but you can certainly pull a back muscle. For example, if you're running and you hit a stone and you have to twist your body, you can actually twist your back and pull a muscle in your back. So pull muscle. So you can pull any one of these muscles. Again, a pull muscle usually occurs, or a strain in the muscle occurs when you stretch the muscle beyond where it can stretch normally. Here I go using the same thing again.
I love it.
Right.
Nice to me, right? Good job.
And you're right. So that's another common running injury. So a lot of times we have our students, especially during champs. And you know, Jamaica is a place where we have a university of running.
Listen.
From Little Picnic.
We're runners.
We are. Don't you used to run at primary school?
I'm telling you, I used to run and get medals and stuff, and I come first. I don't know. It's just since we get older.
Yeah. And that's the thing with Jamaica. We're always running. It's like Brazil is a football country.
That's true. Yeah.
Everybody play football everywhere. In Jamaica, you run, go shop, go buy.
It's true, you know.
Mother said, go buy this. You run. You're always run
it's true.
and skip.
It's true.
Yeah.
You run and skip.
Run
the girl
and
them,
skip.
I go skip.
And the boy them not skip. Come on, man.
Yeah, them I go run.
Right.
You know what I'm saying?
Right. And so you can get the strain of the muscle, but another common injury that you get with running, this is an overuse injury, is ankle. In your ankle, you can actually sprain your ankle. You can sprain your ankle. You can also cause the ankle to kind of go out, become unstable, right? So say you're running, overuse, if your ankle biomechanics is off, and that's the important thing for us to understand with running, because you're doing something over and over and over and over again, pounding on the ground, you always have to ensure that your biomechanics is good. So every time you hit the ground when you're running, and if your ankle turns in, like if you have flat foot, so when you hit the ground and your foot keeps turning, you're always pulling on the ligaments in your ankle, and over time you can sprain your ankle.
So you sprain your ligaments.
You sprain the ligament, absolutely, right? And then And then this is around the ankle. And remember, I tell you I was going to mention plantar fasciitis.
Yes.
A lot of runners will have what we call plantar fasciitis. You remember plantar fasciitis?
Isn't that something under the bottom of your
Yes, pain under the sole, your soles, right? So the plantar fascia is another type of fibrous band which goes from your heel, your calcaneus, to the tips, the base of your toes. Right, it starts there like a point and it kind of fans out in a triangular way. And so when that is stiff, meaning it's not quite flexible, it becomes inflamed and you can have tender spots. It can even tear, right? And you can have a lot of pain when you try to run. And plantar fasciitis pain is especially seen when you wake up in the morning and you step down that first step.
Oh, yes,
and you feel the pain, that little tearing pain in your foot bottom. That's plantar fasciitis. So running, overuse injury, so remember we're talking about the overuse injury now, can lead to plantar fasciitis. Again, biomechanics, right? So your ankle, your foot is always turning in. Of course, that can be treated several ways. One, first thing to do, stretch out your calves and the plantar fascia. So usually people that will get plantar fasciitis, and Achilles, plantar fasciitis with pain on their foot bottom, it's because their calves are tight and the plantar fascia is tight. So we always tell them to try and stretch.
Stretch that.
Right. So when you're sitting down flat on the floor with your knees straight, you can use a towel and put under your foot bottom and pull your foot to your chest. That will help to stretch your plantar fascia as well as your Achilles at the same time. So we can also use that same stretch to treat your Achilles tendinopathy or tendonitis. The thing with plantar fascia, a lot of times it is also because of the type of shoes you're wearing when you're doing this pounding. If you're running and you have a shoe that is not supporting your arch, you can cause plantar fasciitis. So you may need a shoe that has...
Whether you have a flat foot or you have a little arch, okay.
Arch. Well, if you have a cable foot, which is an arch foot, you don't necessarily need that because intrinsically in your foot you have that stability.
Oh, okay.
All right.
Well, at least I got something on my side.
You do. You certainly do. And so with the plantar fasciitis flat foot, you can get arch support. So at Rehab Institute of Caribbean, we're actually preparing to start doing custom-made orthotics. So we're partnering with a company overseas called Running Stride. Corey Baum, and he's an orthotist in Minneapolis.
Wow.
And so we're going to have scanners where you come in and we scan the anatomy of your foot and we email it electronically to him. He will construct the orthotics and make it in a lab, and you get back something that is unique for your foot.
What is that exactly? What does that translate to? Is that a shoe?
It's an arch support. So the same arch support that you buy in the pharmacy.
All right.
A lot of times when you buy arch support in the pharmacy or online, they're good, but they don't necessarily fit your type of foot.
Right.
Because one foot might be a little bit different than the other foot. For example, me, my left foot is pronated. My right foot is fine. And so usually I need a little bit more build-up on my left foot, right? And so that would be perfect for me. And some people where they need custom-made orthotics because they can't put their foot comfortably in the off-the-shelf orthotics. So the custom-made one is for them. So look out for that. We're going to be having custom-made orthotics.
Big thing that's in a dog.
Yeah, man. Thin ones for athletes where you can come and get it to fit your running shoes, more low-profile, sleek, or the bigger ones for people like you and I to put in our sneakers.
Trust me. All right. Sorry. I really want us to get straight into the treatment. I mean, I know you touch on it.
Yes.
But we just need to go dive right into the treatment.
So
for
treatment. So 3 things we're talking about. Treatment for plantar fasciitis. I kind of alluded to some of them. First, you want to control the pain. All of them. Everything.
Yeah.
Plantar fasciitis, stress fracture, everything we spoke about, pain control. Anti-inflammatory, right?
Okay.
After anti-inflammatory, you want to protect the area. So if it is something that's overused, you need to stop running for a while and allow the foot to recover. All right. Then now plantar fasciitis, you stretch. You likely will need physical therapy at the
Rehabilitation Institute of the Caribbean,
where we will teach you how to strengthen the intrinsic muscles of your feet because you have a whole heap of muscles in your feet, and sometimes those muscles have knots. You can't get knots in your foot muscle, you know.
Can't believe
Me
it.
have some knots in my foot muscle. They are so painful, but we can teach you how to get a home program to strengthen the muscles in your feet. In addition to that, you may need orthotics, right? That's for plantar fasciitis. Achilles tendonitis, stretch your Achilles tendon. Now, in the physical therapy that you will do, you will need to do a special type of strengthening called eccentric strengthening. And we at the Rehab Institute will teach you how to do that. And of course, muscle strain, we've spoken about it before. Compression, because there's a lot of swelling, that you treat the same way. Rise, rest, ice, compression, elevation. Right.
Good.
Yeah, and we never even get to blister. Our
Man,
corn and colors.
You want to talk about the blister in about to
Yeah, let me tell you about blister. Blister is just, like when you buy new shoes and you rub your foot back.
From running?
From running. When I have seen marathoners after they run marathon, if you guys were to Google now, post-marathon toes, you will see people with bleeding, redness, serious bruising.
From the shoes and the fact that they're running.
And
Okay.
the fact that they're continually
That
running.
makes sense.
Yes.
Well, that's all we got time for. Thank you all so much for listening to the engineer and our producers. Thank you to the Rehabilitation Institute of the Caribbean, providing medical care for function and performance in association with Winchester MRI, Jamaica's first choice for MR imaging. Denk Pharma, a combination of key active ingredients designed to boost the body's natural defense, and Almighty Studios, a recording studio where we create worship music to praise, to worship, and to serve. That's it. Same time next week. Same place.
Yes.
Blessings.
Take care.
Almighty Studios, your recording studio, a place to praise, to worship, and to serve. Welcome to the new normal industry standard. We are where you can come to worship and rehearse, record, mix or master your music. We have all you need to create your best production, including beat, song, podcast, commercial, and whatever you can ask, think, or imagine. Book your time today at Almighty Studios.